We're going to talk you through how to do primary survey for a baby. So the first thing we do is to check for danger, make sure it's safe for you and the baby, and you don't put yourself or the baby in danger. Once you've established that it's safe to approach, check for response. We do this by gently tapping the baby's feet. If you establish that there's no response, then shout for help. So shout loudly so that those that are close to you can hear you. Don't leave the baby unattended. Then after that, we need to check the airway. So we put our hand on the forehead of the baby and one finger just underneath the chin and tilt gently. So this way you're opening the mouth. If there's something that you can pick or scoop from the mouth, do that, but don't push any further because you cause a blockage. Then after that, we're going to check for breathing. So we do this by putting our ear next to the baby's mouth and nose. We want to look, listen, and feel for normal breaths. So we're looking at the chest to see if it's rising up and down in equal measure. We're listening for normal breaths. We're also feeling to feel if there's anything coming out of the baby's mouth or nose that suggests normal breathing. So no more than 10 seconds, look, listen, and feel for normal breaths. Then after that, we've established that the baby is not breathing. We're going to give them 5 rescue breaths. So again, head tilt, chin lift gently, cover the mouth and the nose, and give them shallow breaths. So 1 breath every 2 seconds. And once we've given them 5 rescue breaths, we go and do chest compressions. So you want to go in the middle of the chest. So if you go from the armpit across the baby's nipple, you get to the middle of their chest. You can use 2 fingers. You're going to give 30 compressions, about 3 centimeters deep, which is third of a baby's chest going down, 100 to 120 compressions per minute. So that's about a compression every 2 seconds. So you have to push and let go, because when you push, you're sending blood that is oxygen to the brain and the rest of the body. And when you let go, you're letting the chambers of the heart fill with blood so that it allows you to continue circulating the blood. After that, we give them 2 rescue breaths. So in the same manner, head tilt, chin lift slightly, cover the nose and mouth, and give them 2 breaths. Then you carry on your chest compressions and continue your 30 to 2 chest compressions.